The basal ganglia is a set of structures in the brain that are important for voluntary motor control, procedural and habitual learning, eye movements, cognition, and emotion. These structures receive neurotransmitters like dopamine that help regulate and facilitate functioning of the basal ganglia and other surrounding areas in the brain. When these functionalities are impaired, problems can occur such as limitations in motor skills, speech, and posture. These impairments can lead to disorders such as Parkinson's disease or schizophrenia.
Schizophrenia is a psychotic disorder that affects the relationship between the patient and the world around them. In order to be diagnosed with this disorder, a person must have 2 out of 5 symptoms listed in the DSM-5. These include delusions, hallucinations, disorganized speech, catatonic behavior, and negative symptoms. At least one of the 2 symptoms must be among the first 3 in the list. Treatment for schizophrenia is generally in the form of antipsychotic drugs. If a patient doesn't respond well to the initial treatment, clozapine is a common alternative. It is successful in about 1/3 of those patients. Once symptoms decrease, patients are often taken off the medication and monitored by primary and secondary doctors in case of relapse. When it comes to non-medical treatments, cognitive behavioral therapy is recommended to be provided for at least 10 sessions over 3 months. Cognitive remediation therapy and social skills training are also options. Some possible causes of schizophrenia are thought to include family history or genetic predisposition, parenting styles, and living circumstances. Most commonly, however, dopamine levels in the basal ganglia are seen as the main cause.
According to the dopamine hypothesis of schizophrenia, schizophrenia happens as a result of increased dopamine transmission at the postsynaptic receptors. This hypothesis has shifted now to a focus on presynaptic striatal hyperdopaminergia. One possible way that dopamine connects to schizophrenia is explained by a model which says that different stressors sensitize the dopamine system and result in excessive presynaptic dopamine synthesis and release. This dysregulated dopamine release ultimately causes irrelevant stimuli to become more prominent, which are then misinterpreted, leading to symptoms of schizophrenia. And these symptoms lead to further stress, which traps us in a cycle of stress and dysregulated dopamine release, eventually hardwiring the psychotic interpretation. Parkinson's is a progressive neurodegenerative disease that manifests its symptoms in the motor, non-motor, and neuropsychiatric area of a person. The progression and symptomology of the disease varies greatly among each individual, and there is no predictable course or timeline of this disease. The characteristic symptoms of PD are tremors, bradykinesia, rigidity, and postural instability. Parkinson's also has many symptoms that emerge at various stages of the disease and affect the cognitive function and the non-motor functions. A person experiences an average of 8 non-motor symptoms in addition to the cardinal symptoms. Cognitive impairments are very common and include anxiety, depression, apathy, sleep disorder, fatigue, psychosis, hallucinations, and dementia. The non-motor symptoms can include digestive problems such as difficulty swallowing and constipation, urinary problems, pain in the sensory system, and sexual dysfunction. Since there's no cure for Parkinson's disease, the treatment is focused on the symptoms of each individual person in order to provide them with the best quality of life while the disease progresses. Some of the treatments include pharmacological, palliative, or surgical intervention.
Parkinson's disease, or PD, occurs when there are irregularities in neurotransmitters such as dopamine and in the basal ganglia. The basal ganglia receives increased activity leading into inhibition of the thalamocortical and brainstem motor systems. This inhibition is because there is a lack of dopamine or lack of activation in dopamine receptors. This dopamine depletion can inhibit neurons in the indirect pathway, responsible for making sure our muscles aren't moving during normal resting phases, and the direct pathway, a pathway that is responsible for allowing our bodies to make movements. The direct pathway projects from the putamen into the globus pallidus and the substantia nigra directly, and the indirect pathway involves neural connections from the putamen to the substantia nigra and globus pallidus indirectly. People with Parkinson's disease experience an overwhelming activation in the basal ganglia and excessive inhibition of motor systems that result in Parkinsonian motor movements. A study of PD patients showed that during active movement, there aren't many strong connections from the substantia nigra to the primary motor cortex and the supplementary motor area. This study shows that thalamocortical motor loops are weakened, impairing those functions due to the dopamine depletion affecting synaptic plasticity.
In conclusion, Parkinson's disease and schizophrenia are heavily affected by the basal ganglia and the neurotransmitter dopamine.